A place like Penn Medicine depends on innovation. We're constantly at the forefront of what's new in medicine, whether it's new therapies, new medications, new ways of doing surgery, new ways of treating people.
Improving patient safety is arguably our most important obligation, and Penn has done an excellent job of advancing patient safety through unit-based leadership, where people who are on the ground interacting with the patients day in and day out identify what some of the risk elements are and what the solutions are.
We've really focused on the whole culture of how we work with patients.
In the last year, we've saved nearly an additional 1,000 lives through our patient safety efforts.
And that culture just pervades all the hallways here. The doctors feel it, the nurses feel it, the radiotherapy techs feel it, the people who are pushing the gurneys feel it. They know they're part of a winning team that's committed to great patient care.
The Blueprint for Quality is our foundational document. It's a strategic plan, but it's a lot more than that.
The Penn Medicine Blueprint for Quality and Patient Safety is a shared vision of all employees, not just the clinical employees.
We developed goals for the organization that we thought would be durable year after year after year. We would have the same goals. They were to reduce mortality, to prevent people from dying, which is the ultimate goal of healthcare, and to prevent people from being readmitted to the hospital if they didn't need to be.
So it's this really big view of the world that we then take and boil down into smaller elements, each of which is designed to make us better and better at everything we do.
Essentially, the way our outcomes are going to keep getting better is through our caregivers and clinicians and staff at the front line.
This is not a top-down, management-driven program. Rather, it involves our unit-based clinical leadership teams, nurses, doctors, social workers, pharmacists, environmental services people, gathering together to look at how things are done currently and then making recommendations as to how they could be improved.
When we began the Penn Medicine Blueprint for Quality and Patient Safety, we established a bold, audacious goal. And that goal was to eradicate bloodstream infections from the Penn Medicine hospital system by January of 2010.
When an infection like that occurs, the patient will die about 25% of the time. So it's a terrible complication, and one that we think is very preventable. So what we've accomplished is pretty impressive, I think. We have virtually eliminated bloodstream infections in the hospital.
We went 1,000 days of bloodstream infection free. So I think the goal on Silver 10 is to have every nurse trained and certified in taking out central lines to reduce the risk of bloodstream infections.
In a complex unit like that, where they do it day after day after day, it starts to sink in how many times they've done this perfectly. And when you think about that, managing this perfectly, doctors, nurses, pharmacists, technicians, it's really, really extraordinary, and it really, I think, motivates people.
1,000 days bloodstream infection free is fantastic, but, maybe that'll be history pretty soon, and it will move on to 2,000, and hopefully the whole institution can put this into their practice.
The Penn Medicine Blueprint for Quality and Patient Safety goes way beyond bloodstream infections.
It's not just providing excellent care or, practicing in a safe moment. It's actually providing that culture of excellence and safety whereby it's on your mind all the time.
The pharmacy department for Penn Medicine really wanted to have a unit-based clinical pharmacy program where you would have a pharmacist per each patient care unit, and part of that process, the goal was to have pharmacists doing medication reconciliation.
Making sure that the patient has the right medicine, right dose, and understands the reason why they're taking those medications.
Patients just don't want to, only access their providers by visit alone. So now it's how do we deliver care through visits? How do we deliver care through email? How do we deliver care through telephone? How do we deliver care when it's transitioning over multiple sites with multiple physicians?
So we want to minimize any preventable readmission or any unnecessary emergency room use.
Again, we're involving that frontline staff, the people who know the job best, to help us make the decisions and the workflow processes that meet their needs and still yield high outcomes.
So the key to this, And the only way it can be successful is if the skill and wisdom of every worker can be brought to bear on the issue of continuous improvement toward a goal that no one gets hurt and gets the highest quality care.